Okay, we're going to start the SMX medical update here. We, of course, bring in the good Dr. Joe McGinley from the McGinley Clinic. Now, this was one of the scariest things I've seen at a Supercross event. I happened to be down near the track. JT and I were on the podium with Will Christian watching, and a horrible crash on the first lap of the 450 main event with Malcolm Stewart and Justin Barcia. Now, we at least know now that both riders escaped serious injury. In the moment, we did not know that. So that's good. They will have a full recovery going forward. We can now just focus on the return to racing. So we'll get to Barcia, who had a more significant injury, in a moment. But Joe, let's talk about Malcolm Stewart. They said dislocated shoulder. They got it back into the track. That always sounds good. Is it as good as it sounds?
Again, it's never as good as it sounds with these type of injuries. First, again, let's talk about the injury itself. So he had a dislocation. Remember, we differentiate separation and dislocation. This was a dislocation. They did get it reset right on the track. That's the most important thing, is trying to get that aligned as quickly as possible. And then he had no immediate deficits in that arm. Yeah, it's not feeling good, but he's able to move his hand. He's able to move his finger. So we know there wasn't any significant nerve damage or blood vessel damage. So at that point, now you're talking about medical imaging. You go through the diagnostic protocol and then the recovery process. So with Malcolm, fortunately, he has a lot of muscle mass, and muscle mass is helpful in this situation. So no matter the injury, that muscle is going to help protect the shoulder, and it's going to provide stability. Structurally inside, when you have a shoulder dislocation, the structures that tend to get injured are the labrum, which is essentially the gasket of the shoulder, and then the ligaments, which help provide stability. But in Malcolm's instance, he also has extra muscle mass, which is great for providing stability and strength on the shoulder, alleviates some of the stress on the labrum and the ligaments, and allows him to recover quicker and get back out there riding with confidence.
Yeah, and honestly, by the time this show airs, folks, we might know more about Malcolm's status, if he's in or out for this weekend at San Diego. You hope he is, because we heard so much hype about how well he was riding in the preseason, and hopefully that carries over and he doesn't lose too much. As for Barcia, again, escape without serious injury, but we can presume he's going to be out a little bit longer. His video, which again, I can't believe he's just posting a video Sunday afternoon, looking no worse for wear. Broke some of the winglets, he said, on the vertebrae, but otherwise, that's about it, which is mind-boggling to me and fortunate. So what do you think when you hear that, Dr. Joe?
Yeah, when I watched that video, I thought this was going to be a scary conversation today, having that about Barcia, but really from what we saw on TV and where he's at, this is best case scenario. I heard he was wearing the Alpine Star airbag, so that likely helped as far as the injury prevention. He did have a fracture of what's called the transverse process, and it is essentially just a small wing of the bone in the spine. It's not structurally that important, so this isn't one of those scary spine injuries where you think about patients being paralyzed. However, it's still going to hurt. It's still a broken bone. That's going to hurt. And then the other thing the body does is, even if you have a small chip fracture like that, all the muscles around it will spasm to protect it, and that can create severe pain, severe discomfort, and limited motion. So I'm sure he's not feeling very well. But yeah, that could have been a lot worse. This conversation could have gone a lot differently. And in addition to that, they did report a concussion. So obviously with that type of impact, that he's going to be going through a concussion protocol. They'll be monitoring him for recovery.
Yeah, so him returning to racing doesn't feel like the most important aspect, but hey, that's what we do here. So talking about timeframes for recovery, what do you see being the most problematic, or what does that look like? Because from what you're saying, it doesn't sound like he has severe injuries that are going to keep him out a long time, other than, of course, need to recover from concussion. But as far as the back injury goes, is this something that, even if it's not fully healed, he could recover from, or what does that look like?
It depends how treatment's going for him. So there's different types of treatments based on his goals. So the concussion protocol, that is going to be the time limiting factor. That's a red line, right? So you have to clear the concussion protocol to be able to ride and race. So that one, there's no flexibility on. But as far as the back, that fracture, it may or may not heal back together on that bone. Again, it's not significant long term. And then getting those muscles worked on, I'm sure he'll be working with his chiropractor, his physical therapist, to try to alleviate some of that tension in the muscles, hopefully some anti-inflammatory protocols. And then it's just how he feels as far as recovery. He mentioned his neck was stiff. Again, that's going to be muscle spasm from that essentially a whiplash type injury. That can take days, if not weeks, to fully recover. So we won't be seeing him this weekend. But as far as recovery from there, it's just how quickly his body responds to the treatments he's getting. There's nothing physically preventing it from a mechanical standpoint other than that concussion protocol. So it's just recovery at this point.
We'll see you at the races, man.
Thank you.